actually made in your liver at night when you sleep, okay? So all of the cholesterol that you're eating in your diet is just extra cholesterol, okay? So it's hugely important that we understand that our bodies are capable of making cholesterol, and then any additional healthy fat that we put in, it has to be healthy fat. It can't be trans fats, these unhealthy vegetable oils, things of that nature, okay? So that sort of gives you a little bit of background, with the approach to clogged arteries and heart disease. So let's jump into sort of what actually causes heart attacks, okay? As I mentioned before, most of the time people will say that heart attacks are caused by, elevated cholesterol levels causing atherosclerosis in the arteries, clogging up the arteries to get clogged, which causes increased pressure in the heart because you can't perfuse the heart with blood, and as a result, the heart overworked, has a heart attack, okay? All right, so that's the old way of thinking, okay? A much more efficient way to think about it is to think about, well, if the cholesterol clogged the arteries, okay, what actually caused the cholesterol to cause the arteries, okay? Our diet, right? And most people, when they think about it, they think, okay, he ate too much fat or she ate too much fat. That's actually not it. Fat isn't what causes a lot of cholesterol elevation in the body. It's actually sugar, okay? It's actually sugar. Elevated sugar actually causes cholesterol. Let me give you a few examples. We eat, on average, Americans eat about 152 pounds of sugar every year. Okay, so just imagine 152 pounds. That's a grown man. That's a grown lady. Okay, but in addition to that, we eat about 135 pounds of white flour. Okay, so you combine those two things. Sugar and white flour causes inflammation in the body. Okay, so not only that, all sugar, especially excess sugar, and all of that, white flour and added sugar is excess sugar. All of that sugar will be converted into cholesterol. Okay, so that sort of gives you an idea of why, the American diet is really a prescription for a heart attack. Okay, but also what's really important is eating an excessive amount of white flour and sugar and processed food causes inflammation in the body. Okay, so if it causes inflammation in the body, it's going to cause inflammation in the heart as well too. Okay, so think about it. We live an inflammatory lifestyle. Okay, an inflammatory lifestyle means you stress. An inflammatory lifestyle means that you don't get adequate sleep. An inflammatory lifestyle means that you don't get adequate amounts of water. You don't get enough exercise. And it also means that you're eating very poor food that is inflammatory. You're on an inflammatory diet. Okay, so it inflames the heart, namely sugar and white flour. But just think about that for a second. I'm going to correlate this back to the cholesterol now, okay? The cholesterol is coming in the artery not because you just ate it. That's not the only reason it comes in. The reason why it comes in is because cholesterol is there to build and repair, okay? You got to remember what I said earlier. There's cholesterol in virtually every cell in the body, in that lipid bilayer. So we need cholesterol in every cell in the body. So it doesn't make sense that cholesterol is this dangerous thing, right? Cholesterol is there to build and repair, okay? So what happens is we eat this inflammatory diet. Those inflammatory foods not only cause inflammation inside of the vessels, but they cause these micro tears. That type of food causes micro tears in the vessel as well. And the cholesterol comes in there to patch it up. Okay, so these micro tears happen inside of the blood vessels and the arteries in the heart, and then the cholesterol comes in there to patch it up. Now, what happens is, as we continue to eat this food on a daily basis, 3 times a day, 365 days a year, we're constantly assaulting the lining of the blood vessels, okay, or the arteries. So the cholesterol is coming in there every time to patch it up. So each time it adds another layer, that layer gets thicker until that blood vessel closes up and occludes, and that's what causes a heart attack. But you can see it's not really the cholesterol. It's the assault. It's the inflammation. It's the diet itself is a major contributor, okay, among other things, okay? The other thing, in addition to inflammation, in addition to a processed diet that is sort of laden with sugar and white flour, is obesity, okay? But you can see how these things are tied together. As I said before, the more sugar you eat, that sugar will be converted into fat. That process is called lipogenesis. Now, you've heard about somebody going to get lipo, which is fat removed, but genesis is not just, it doesn't mean beginning, it means synthesis, it means production. So lipogenesis, make fat. And the fat is being made from all of that sugar, from all of that flour that Americans, we eat on a daily basis, okay? And as we're making more and more fat, that is what is creating the obesity epidemic. As a matter of fact, 75% of Americans are either overweight or obese, okay? So take that statistic right there. If there's 10 people in a room right now, 7.5, or roughly 8 people, because it can't be a half person, 8 people are going to be overweight or obese, okay? Just think about that. If there's 100 people in the room, 75 people are going to be overweight or obese, okay? That's America today. That is the first time in history that's ever been, a fact. So you got to understand something's changed, something's different. And what's most important to understand about obesity is this. Obesity increases cholesterol in the body, okay? So it's going to increase fat in the body. That's obvious. It's also going to increase your blood pressure, okay? It's also going to increase your risk for diabetes. Now you're metabolically unhealthy. And it's also going to put a lot of pressure on the heart, because typically when people are obese, a lot of that fat is going to be concentrated in the torso area. So it's going to put a lot of pressure on the internal organs, but also a lot of pressure on the heart, because now this fat is going to be throughout the tissue in the heart and all around the other organs as well too. So obesity is a major contributor. As a matter of fact, obesity is probably tied with high blood pressure, which is a silent killer, as 1 and 2 risk factors for heart disease or a heart attack, okay? So of course it makes sense. If they're the primary causes, then it makes sense that they're the primary solutions too, to lower the blood pressure and to get to a normal or healthy blood body weight, okay? So hugely important. Other causes are going to be deficiencies, okay? Now, what you'll notice is, for those of you out there who either have an uncle or aunt, or maybe you have been put on prescription medications for things like high blood pressure, coronary artery disease, etc. What you'll notice is that many of the things are correcting issues with deficiencies. I'll give you an example. A lot of people will take a drug called Norvasc. Norvasc is a calcium channel blocker. So it's sort of manipulating the calcium in the body, okay? A lot of people will also have issues with potassium. Potassium is very key when it comes to, heart health, okay, and blood pressure. Also, another key element is going to be magnesium as well. And a key nutrient will be quercetin, okay? Quercetin it can be found in food. Okay, so you can find quercetin in food. And the cool thing about quercetin is when you eat the right foods, quercetin, a natural nutrient found in foods, can inhibit oxidation. Okay, what's the issue with oxidation? Okay, you remember when I was saying earlier how cholesterol is simply a builder and repairer? Okay, it just goes in and builds and repair. Okay, when there's inflammation, when there's insult. Okay, a lot of the insult is occurring once the cholesterol comes in to build and repair and patch up the spot, like putting on a Band-Aid. Oxidation comes in and makes that cholesterol hard. Okay, so that's why they call it, plaque in the artery. It gets hard. Okay, it's oxidation that's causing that. Okay, so if you eat foods that have the right nutrients in them, like quercetin, the really cool thing is that they're antioxidants. Okay, so they're going to prevent the oxidation, which means it's going to prevent the hardening of the arteries. When the arteries get hard and stiff, they're hard to move blood through. Okay, if something is stiff and hard versus very elastic, the stiffness is going to cause an increase in pressure. Okay, the best example I can give you is I can give you a pipe that's made of like PVC pipe that's thick plastic. Now that is very hard, so the pressure is going to be hard inside of there. But if I give you a balloon and put water in it, it's very flexible. Okay, so the pressure isn't going to be as high in there. Okay, and that's what happens. Okay, when you're getting this plaque in there as a result of oxidation. Okay, hugely important. So you want to correct deficiencies. The other thing is toxicity. Okay, there are a lot of cardiotoxins, things that are toxic to the heart tissue. Okay. And these cardiotoxins will cause arrhythmias, okay? So if you might have an arrhythmia, you can have a murmur, things of that nature. Chemo drugs, radiation are actually cardiotoxic, okay? I'll give you an example of a drug called doxorubicin. Doxorubicin is used for breast cancer, okay? Doxorubicin is a cardiotoxin, okay? Radiation is a cardiotoxin, so it can affect the heart. As a matter of fact, a large majority of patients who die of cancer, a large majority of them who use chemo, a large majority of them actually die of a heart attack, okay? They don't actually die of the cancer, okay? So it's really important. Erectile dysfunction drugs. So drugs like Viagra, Cialis, these drugs are actually cardiotoxic. As a matter of fact, Viagra, when it first came out, it came out as